Hi, everyone. I'm Skylar Henry in for Tanya Rivero. Thanks for joining us. President Biden met with governors on Monday whose states are severely impacted by COVID-19. The spread of Omicron is fueling an uptick in cases nationwide. The U.S. is averaging more than 198,000 cases and more than 1,400 deaths every day. Nearly 170,000 children in the U.S. have tested positive between December 9th and 16th, up about 28% from the previous two-week period. And a rise in children's hospitalizations in New York is causing concern across the country. New vaccine requirements start today in hard-hit New York City. Diners 12 and up will have to show proof of vaccination to eat indoors, and workers at more than 184,000 private businesses will also need to show they've received at least one dose of the vaccine. This morning at the White House, the president pledged governors all the support they need.
If you're unvaccinated, you're at a high risk of getting severely ill from COVID-19, being hospitalized, and in rare cases, even dying. And this is not like March of 2020, the beginning of the pandemic. We're prepared and we know what it takes to save lives, protect people. My message to the governor is simple. If you need something, say something. And we're going to have your back in any way we can.
I want to bring in Dr. Stanley Perlman. He's a professor of microbiology and immunology at the University of Iowa. He's also a pediatric infectious diseases physician. Dr. Perlman, welcome. Thanks for joining us today. Let's start with the concerning number of COVID cases in children. In New York, child hospitalizations have quadrupled since early December. Around half of those hospitalizations were kids under the age of 5 who actually can't get a vaccine. So what's the holdup for vaccine approvals for children in this young age group?
Yes, so my understanding of this is that the initial studies just didn't show sufficient efficacy to move forward. So the additional studies are being done to make sure that there's a good immune response in these younger children and that it'll be sufficient to protect children from disease.
And so that's the thing. The rest of the children who were hospitalized were ages 5 to 11, all eligible for the vaccine, but none of them had it. Dr. Anthony Fauci is encouraging parents to get their kids vaccinated. Let's listen in.
Now that we have the capability and the authority to vaccinate children 5 to 11, that we're encouraging parents that if you have a child from 5 to 11, please get that child vaccinated to prevent them from getting anything that even resembles a serious illness.
Okay, so Dr. Perlman, nearly 14% of 5 to 11-year-olds have been fully vaccinated. The rate of vaccination has slowed considerably. So how can we get more kids the actual vaccine? And what, if any, concerns do parents still have about the actual vaccine themselves? I know that's a big problem as well.
Yeah, so I think that we can just continue to encourage vaccination. Parents have to make the decision for these children. These low numbers means that these children are going to be susceptible to infection. And some of them, even though children develop much less likelihood of severe disease, some of them will develop severe disease. So it's really just a numbers game. If more children get infected, even if it's a low percentage of those who are infected develop bad disease, the numbers will be higher if more of them become infected. And especially as more adults become vaccinated, we know that the proportion of those affected will be children. We also know that the Omicron variant is spreading extremely quickly, as you've noted earlier on the show. And even though the disease may be milder, it is infecting and affecting more people.
And we talked about cases going up, especially in hospitals. Hospitals in Massachusetts are postponing all non-essential elective procedures. This move is to free up hospital beds for COVID patients, and hospitals are also facing staffing and shortages. And the CDC recently shortened the isolation time for healthcare workers to about 7 days. Will measures like that be enough to make sure hospitals aren't overrun, or do we actually need to take some more drastic measure in order to try to get this Omicron spread under control?
Yeah, so I don't know that that'll prevent Omicron spread. What that'll do a better job of doing is making sure that our hospitals are not overwhelmed so that our healthcare workers don't burn out, which we're seeing a lot of. So that's really what it's doing, is make sure there's enough beds for people who really need acute care or even ICU care.
And that's the interesting thing. So while cases are surging, Dr. Fauci says that we're only beginning to see these cases rise and that it will get much worse. Listen in.
The way it's going up right now, it's going to get worse before it gets better, that's for sure. We don't expect things are going to turn around in a few days to a week. It likely will take much longer than that, but that's unpredictable.
President Biden has said his plan to fight the pandemic doesn't include lockdowns, but across the country, we're seeing businesses start to close on their own. Shows like on Broadway, sporting events, bowl games, and college are being canceled as well. Do you think a lockdown or some version of that is actually needed to get Omicron under control?
Yeah, I think it's a very good question because in the past, lockdowns have worked to some extent, but they've had a lot of pushback and a lot of other problems. So if we can get by without a lockdown, that would be better. If we had a complete lockdown, we might prevent the spread more. But there's so many consequences of the lockdown that I don't think that decision should be taken lightly.
All right. Clearly a long road ahead for all of us. Dr. Stanley Perlman, thank you so much.
You're very welcome. Thanks for having me.